Great Day Live on WHAS 11 is sponsored by the Mattingly Center.
Facing a cancer diagnosis can be the darkest day of someone's life. Fighting prostate or lung cancer can be especially scary. Prostate being the second most common cause of cancer death in men, and lung cancer being one of the most common here in Kentucky. And Dr. Neal Dunlap and Dr. Moataz El-Ghamry are radiation oncologists at Louisville CyberKnife. Gentlemen, welcome. Glad to have you here.
Great, thanks for having us.
Please explain this robotic process.
Well, this robotic process basically...
Okay.
Okay, all right.
Yeah,
so basically, it's a radiation machine mounted on a KUKA. What is the KUKA? It is a robotic arm of the BMW and Mercedes-Benz plant in Germany. So it has a super accuracy. Need this one.
Mm-hmm.
So it will have a super accuracy of how to delineate and targets.
Okay,
Yeah,
there you go.
Yeah. Okay. You know, so the radiation is coming from this side, and the patient will be in this area. So it has all of the angles of freedom of how to treat the small tumors or the average size tumor.
And we're talking about non-invasive.
It is non-invasive because
procedure.
it's a radiation treatments. It's not like a knife, like a surgeon's knife.
And we're talking about this can work in terms of tumors in the head, neck, torso, anywhere?
Right. Pretty much this machine, it was originally designed, I think, primarily to treat lung cancers, but is expanded into treating all parts of the body. So it's a machine that allows for a lot more flexibility in terms of treatment, allowing for pinpoint accuracy, like Dr. El-Ghamry was alluding to. So I think it's been a great advance in radiation therapy for patients to give them more options for treatment.
And we're also talking about a system where people aren't bedridden for days. I mean, you can pretty much get back to your life right away after, what, 5 treatments?
Yeah, most of the treatments range anywhere from 1 to 5 treatments, depending on the site. Like Dr. El-Ghamry had mentioned earlier, this is a non-invasive type of procedure where a patient lays immobilized on the machine and really has no restrictions. They can get back to their normal living sooner than they probably realize they can.
And Dr. El-Ghamry, there are particular benefits for those with prostate or lung cancer?
Yes, usually prostate, lung cancer, pancreatic cancer, brain tumors. In terms of prostate cancer, usually when you have a local prostate cancer or early prostate cancer, the radiation treatment will be about between 40 to 44 treatments every day, Monday through Friday. We're talking about 8 to 9 weeks of treatment. With CyberKnife, it's about 5 treatments only.
I see. And men are oftentimes skittish about going to the doctor. They don't want to know. They don't want to know.
Yes.
But this is a non-invasive procedure. This is a lot more comfortable, for lack of a better expression.
Exactly, yes.
Than what people are talking about, not being invasive. Now, what are the numbers on men? Is it 1 out of 6 men are going to get prostate cancer?
1 out of 3, actually. So if you biopsy one of us right now, one of us will have prostate cancer. But we have to say something.
Hopefully that's not you.
Yeah. Yeah. But we have to say something that in terms of prostate cancer, there are many options, like for early prostate cancer. Active surveillance, which is no treatment. Some patients will benefit from no treatment. Some patients will benefit. You know, there are other options like surgery, radiation therapy, CyberKnife, or seeds. So the most important thing when a patient will have a diagnosis of prostate cancer, my suggestion, they should seek an independent advice about a second opinion or so on and so forth. In terms of other options, because there are many options in terms of prostate cancer.
And lung cancer is a horrific scourge in the Commonwealth of Kentucky. So much smoking and...
Right. Kentucky, unfortunately, leads the country not in only the numbers of diagnosed in terms of the incidence of lung cancer, but also the mortality or death rate. So one of the biggest advances in lung cancer right now is the results of the National Lung Cancer Screening Trial, which was recently published back in this fall, which showed that with early detection in lung cancer, we can reduce mortality by 20%. And in patients that have early stage cancers, those are curable, and this machine offers an alternative to surgery in patients that are otherwise high risk for surgical procedures. The unique thing about this machine is that when you think of a cancer in someone's body that's in the lung specifically, a person's taking a breath in and out, and that machine or that lung cancer is moving with that person's breathing. Unfortunately, radiation machines are not that accurate to be able to follow tumors as they're moving, and so you end up having to treat a lot more normal tissue in someone's body, which increases the side effects of the machine. Exactly. So with this machine, we're pinpointing it, and the machine actually will follow that tumor. So when the tumor moves, the machine's moving with the tumor and can lock onto that, so you can treat the tumor accurately but eliminate side effects.
You are looking at the future right there. Louisville CyberKnife. It's a James Graham Brown Cancer Center. For more information, call 217-8200 or visit ck.com. Thank you, doctors.
Thank you.
Thank you.